Welcome to the Kids Eating Broccoli podcast, where we believe that raising healthy kids shouldn't be complicated. Our mission is to inspire 20 million families worldwide to take the steps to raise the healthiest generation in our history. We'll interview some of the world's leading experts in nutrition, human potential, and children's health, as well as extraordinary chefs and foodies to gain insight into simple, fun, and creative ways to introduce natural health into homes across this planet. All right, well, welcome to another episode of the Kids Eating Broccoli podcast. For today's episode, we bring back one of our previous guests, Dr. Marco Ferrucci. And today, Dr. Marco is going to talk to us about the topic of diabetes and some lifestyle and nutrition and all kinds of natural things you can do at home to help with diabetes of all different kinds, of all different ages. And he's got a unique story to share with us around that. So I look forward to diving into that and seeing what kind of wisdom we can pull out. So Dr. Marco, thanks so much. Why don't we start by having you tell us, recap who you are, if anybody hasn't heard the other episode with you yet, and we'll dive in from there.
Excellent. Thank you so much for having me on here. It's funny, if you asked me this question of who I am a year and a half ago, I'd have a different answer. But we're at this point right now, so I could share what's going on in my life now. So as you know, I've already was a guest on the show, but for people that did not meet or see that episode, I'm a chiropractor by trade, but I have a lot of background in nutrition and neurology and things around that realm. But where my interest came in diabetes actually came because of a life change that I had to make. About a year and a half ago, I personally was going through some health issues, which, most of my life I always thought I was living a healthy lifestyle. I mean, I went to chiropractic school. I eat well. I thought that I was going in the right direction with my health. And about a little bit over a year and a half ago, I started to lose weight. And I thought it was just due to stress. I had a lot of things going on during that time period. And I started to lose a significant amount of weight for what I knew for losing weight for myself. So I only lost in a 4-month period 15 pounds. But in my life, I never lost weight. So to me, that was weird. So when I went to the doctor, they tested my blood sugar and much more. And I didn't think this was the reason why I was losing weight, but when they came back with my blood results, he said to me, I figured out why you're losing weight. He's like, you're diabetic. And to me, that was the craziest thing to hear because I never thought the lifestyle that I was living, the body type I had, that I would develop diabetes. So they originally diagnosed me with type 2 diabetes, which, is the developmental one over time. And due to usually lifestyle habits that are unhealthy and the body style is usually not my body style, so it didn't make sense. But that was the first diagnosis, and then they started to put me on some medication to help with type 2 diabetes, which unfortunately didn't work with me and obviously didn't make sense to me. So when I started to take that medication, my blood sugar started to rise higher. So that didn't work out for me. So I got a specialized testing with an endocrinologist that looked at my blood work and immediately diagnosed me with type 1 diabetes, which at the age of 34 years old, that's it's rarely heard that you get it diagnosed at that age. It's usually a little bit younger. But after doing my research, I learned that you can develop it at any age, and we're going to talk about why. But I got diagnosed with type 1 diabetes, and they said you have to start insulin like today. So she got me on my first dose of insulin, and that's when my blood sugar started to come down. And then from that point, we're talking September of last year, I literally took my life on a mission to figure out everything I know about type 1 diabetes, type 2 diabetes, what causes it, what are the best ways of living your lifestyle. And, through that research, I learned so much and really found out that type 1 diabetes is really autoimmune. And it makes sense that my body developed type 1 diabetes later in life because something in my body changed that caused it to attack itself, and it decided to attack my pancreas. which messed with my insulin output and messed with my blood sugar. So once I learned that, I did some specialized testing to find out why I was autoimmune. And I mean, we have this conversation to go more deeper into what I've done in my life, but that's a good introduction to, why, a conversation about diabetes, is important, especially from somebody that's dealing with it, and during the month of November, which is Diabetes Awareness Month. So
right,
I'm excited for that.
Yeah. Well, that's definitely an unusual story, certainly as far as, what I've heard, mostly because of the things you mentioned. Type 1 diabetes, we often think of as onset as children. They used to call it childhood onset. And also that you were living a healthy lifestyle in addition, or what you thought was a healthy lifestyle. But, what probably most people would assume was a very healthy lifestyle compared to the norm. And that even with those things, that this is something that occurred for you, and so, yeah, definitely an interesting story in terms of that. So why don't we just dive into kind of what you learned about what changes you needed to make, and maybe weave in there, how you discovered that, or what you discovered about the cause, or what you think the cause happened with your body.
Mm-hmm. Of course. So when it comes to autoimmunity, whether it's with diabetes or another autoimmune disorder, something in your body is not functioning at its best, thus it starts to attack itself. So there's many different things that could cause that. One thing that could cause that, and we discussed this in the last conversation, but the leaky gut. A leaky gut is due to it could be due to dietary stress in the digestive system. What it does, it causes inflammation in the stomach, breaking down the wall of the stomach lining, allowing certain bacteria and proteins to leak from your stomach into the bloodstream, and then your body sees that as an attack, and it starts to attack that, and it could also attack your body. So that's the leaky gut aspect of it. It also could be due to a virus or a bacteria that kind of took over your body at the time, and it could attack different areas of your organs as well. So, and it's ironic that shortly before I started losing weight, I actually was very sick, more sick than I normally ever get. Like I actually had to take off about 2 or 3 days from work, which to me, I never like to take a day off of work. So for me to be bedridden for a couple of days, maybe 1 week, that was weird to me, but I didn't even link it to anything. I just thought, I was run down. I just was on a vacation, so maybe just going on the plane, maybe I developed something. That's what I was telling myself. And then that was the point where I started to lose the weight, but I didn't connect it until, later on when I started to dig in and figure out. So I think that I had some type of virus or bacteria that attacked my body. Then I did some specialized testing. There's specialized testing you could take to find out if you do have a leaky gut and if you have food sensitivity, because food sensitivity could also cause that to happen. So I did all this specialized testing. I found out that I was highly sensitive to gluten. I found out I had the leaky gut. I didn't do any testing to find out if I had the bacteria virus, but I'm retrospectively thinking that was a part of it as well. And another thing that could cause autoimmunity is chemical toxicity, which there's some specialized blood testing you could do for that, in which I did do the testing, but I did not come back with chemical sensitivity. But when you look at that and you're looking, okay, well, I had leaky gut, I had a virus or bacteria shortly before that, and I also am highly sensitive to gluten, and I was eating that, somewhat on a regular basis. I mean, I was trying to limit it, but I still was having it. So that whole array of things that occurred obviously was attacking my body, and like to choose my pancreas as the main source, and messed with my insulin levels, and that's where the development of that diabetes went unnoticed, because I never had it before, and I just thought that I was under stress and losing weight. But knowing that, now I know that the number one thing I had to do was, obviously, if I was highly sensitive to gluten, I removed it from my diet. But I obviously went to another step, and I was like, well, a lot of people that are sensitive to gluten could also be sensitive to dairy and soy. So I actually even limited that in my diet. So I really removed things that were inflammatory and sensitive to my body, in which my body was able to heal. Then I started taking some supplements to repair my stomach, because I showed the leaky gut symptoms. And even on the blood work, it showed that I had certain markers that were showing antibodies to certain parts of my stomach lining that would show there's a leaky gut. So I did that, and I started taking some supplements. One supplement that's great for repairing the gut is L-glutamine. So I took a high dose of L-glutamine, and I was just taking some really good tissue repair stuff to help to repair my stomach lining. And I actually did that for 3 months, and during that process, number one, my blood sugar stabilized, and I was able to stabilize my blood sugar with only one dose of insulin, which is, there's two types of insulin. There's long-acting insulin, which is a 24-hour dose, and then there's short-acting, which is one you're supposed to take with your meals. I only take the long-acting one at night to give me a baseline insulin for the day. And then because of my diet, which is very low in carbohydrate, it doesn't drive my blood sugar up. So I'm actually taking less insulin every single day than most people that are diagnosed with type 1 diabetes. But it's because not only am I getting rid of the things that are causing my body to attack itself, but I'm taking out carbohydrates, which is the thing that raises the blood sugar the most. So that type of lifestyle has really got me to the point now where I feel the best I've ever felt. I physically look the best I've ever felt. I'm down, 10 pounds from where I was last time, but it's a healthier weight because I wasn't as bloated and heftier from the foods I wasn't supposed to be having. And I only take a small dose of insulin at nighttime, and I don't have to take it with my meals because I'm eating a pretty healthy life. And with that, over the past year and a half, I've had my blood sugar very balanced. My endocrinologist even is like, I don't know what you're doing, man, but keep going with what you're doing. You're obviously keeping your body healthy. I personally don't get it. He was a medical doctor. He didn't get that you can actually do this without taking high doses of insulin. But when you realize that the big thing that destroys your blood sugar, at least rises your blood sugar, is high carbohydrate intake. So if you lower that, and I'm on a ketogenic diet, so it's a low carbohydrate, higher protein and fat diet, there's no reason for my blood sugar to rise so high because I'm not consuming the sugars that rises it up. And that's what I really wanted to do in this segment, is to focus on the fact that if you're diagnosed at a young age or an older age, the problem is still the same. It's either you had an autoimmune attack that you're not getting under control, or you're having a high carbohydrate diet, or a combination of both. So I'm excited that we could share this information because I think it needs to be heard.
Yeah, well, I think so too. I mean, just with what you were mentioning with your endocrinologist, and then thinking about, other kids and families who I've spoken with who, have a kid that's been diagnosed with type 1, that you don't hear, lifestyle modifications. I mean, not much, like don't smoke and don't drink excessive alcohol. I mean, like the basic stuff, but nothing like, hey, if you follow these dietary guidelines, you'll significantly improve your symptoms, significantly decrease the amount of medication you have to take, which we know there's a lot of sort of longevity risk factors, for type 1 diabetes. And a lot of that has to do with taking the medications over a long period of time, and that, that fluctuation in the blood sugar and insulin, because, from the outside, we can obviously never manage as well as our own body could. So if we're constantly in that cycle, which it sounds like you've been able to break in terms of taking the insulin after every meal and having the blood sugar spikes and all of that, that you're setting your body up for much better long-term health, aside from, your current symptoms and how you're feeling.
Yeah.
I think it's...
And I also want to mention that most people, especially in the type 2 diabetes world, type 1 diabetes typically tends to have a little bit more control over what's going on because either they were diagnosed at a young age or they know they need the insulin. But I noticed when I talk to people in the type 2 diabetic world, they're not managing it the way that they should. And they know they have blood. Like I've talked to men and women and young and old say, I know I have type 2 diabetes, but I don't want to give up the things that I love. So they literally are living their life knowing their blood sugar is 300 or 400 when it should be well under that. Yet they just say, I just take my medicine and I just eat what I want. Meanwhile, they're still in their higher numbers. And, unfortunately, the risk that comes with that in the long term, is heart disease and stuff like that, which they don't link together. So it's very rare that you hear that, that people are going from diabetes to heart disease. But that's actually one of the risk factors for heart disease is unstable blood sugars. So I noticed that in type 2, it's like they're just okay. Like they use their medicine as their crutch, even the insulin. for type 1. And now it's getting to the point where some type 2 diabetics are needing insulin because their blood sugar is so out of control, they need to take the insulin to lower it. But it's just, there's not enough education out there about why it's important to take care of it now and not wait until it gets to a point where you need insulin or you need to get some other medical intervention because another disease has come to develop. So it's really just getting an understanding of why it's going on and then figuring out what steps they can take to reverse that, because it's obviously better to live a lifestyle with lower blood sugar than higher blood sugar. So it's really more just getting an understanding.
Excuse me. Got something in my throat. Okay. I'm going to ask you a question so I can cough off mic. So why don't you tell us, get into some of the detail about, you mentioned low carb and so forth, but maybe get a little more in the nitty gritty of some of those
Absolutely.
lifestyle changes.
Yeah, absolutely. So, you got to think about blood sugar. Blood sugar is going to rise from carbohydrates, but there also is going to be a rise from protein as well, but at a slower, longer pace. So the biggest things that are going to rise your blood sugar is carbohydrates and high protein. Fat doesn't really affect your blood sugar as much as the other two, but when you look at those 3 macronutrients, which is the main ones that we put in our body every day, if you look at our all-American diet and the diet that most people recommend, even in the American Diabetes Association, they recommend having 40 to 60% of their diet being from carbohydrates, which is a lot. Let alone somebody that isn't diabetic, that's a lot. But then you have somebody that's literally diabetic and sensitive to carbohydrates. You're telling them almost half of your diet may carbohydrates, but just counter that with the medication or insulin that you're asked to take. So when I learned that and I'm looking at it, I'm like, that doesn't make sense. Why would you it's like telling an alcoholic only have, you're alcoholic, but you can have, 2 or 3 glasses a day. Just don't go more than that. That's crazy. So I was like, why am I going to put something in my body, i.e. carbohydrates, that is going to raise my blood sugar? And then I got to deal with trying to figure out how much insulin to take at that time. Maybe I have to walk around with the pump, and then I have to worry about the pump doing all that. And it's just there's a lot of external intervention that allowing my body to heal and allowing my body to function at its best, that I didn't want to deal with that. As a doctor of chiropractic, we typically look at the natural, holistic ways of healing yourself. So it was good that I was in this world. If I was in a different world, I might have just said, okay, I have to get the pump, I have to do this insulin, and I just have to live my lifestyle. But as somebody that I feel like we think outside of the box than the normal allopathic medicine, it just didn't make sense to me. If carbohydrates are the main reason why my blood sugar is rising, well, then why am I going to put that in my body? There's other sources of energy and fuel that you can get, which that's where the confusion comes, because there's a thought out there that your energy comes from your glucose, which is true if that's most of your diet. But if you remove that and there's no other source of energy, the body's always in a state of trying to adapt. It's going to choose a different source. Now, if you're removing carbohydrates and replacing it with a higher fat and protein diet, the next thing it's going to choose is the fat and protein to start using as energy. When you break down fat and protein, it's going to break down into what's called ketones. And this is where this ketogenic diet really comes into effect. And ketones are a much more efficient source of energy for the body. You could even tell based on when you look at your macronutrients, fat, protein, and carbs, the amount of kcalories or calories that you get from fat versus protein and carbs is double the amount. So you get 4 calories for every gram of carbohydrates and protein that you have. But when you have fat in your body, you get 9 calories per every gram. So you get double the amount of energy from a different source of food. So it only made sense to me, well, why don't I get on a diet that's higher in fat and protein, because that's a little bit less of a result on your glucose levels, and then not have the carbohydrates, because that's what's rising my blood sugar. And then all of a sudden it makes sense that my blood sugar is staying down. Yeah, do I have my days where I maybe pick on something that has more carbohydrates than I should and my blood sugar goes up? Yes, because I'm not taking that insulin. But it's more rare than it is common because I'm very aware of what I'm putting in my body. So that type of lifestyle is really what most diabetics should be on. But who the heck's saying that? Their medical doctor's not telling them. A lot of the other people, nutritionists and stuff, they literally believe that you have to get your energy from your carbohydrates. That's literally in their mind. So if you're not having carbohydrates, you're not getting the fuel that your body needs. And that's where we get a disconnection in the education. Because if you look at, I talked about this, I had a talk the other day at my office about the ketogenic diet. And if you talk about foods that are essential to the body, meaning that it's essential, meaning your body can't make it, you have to get it from an outside source. So the two essential nutrients are fat and protein. You have to consume that from an outside source to put that in your body because your body can't make it. Carbohydrates are not essential. If you look at the essential nutrients, carbohydrates are not essential. So your body can live without that carbohydrate intake and still function at its best. But without fat and protein, it can't. So with that knowledge, you got to think, well, maybe I don't need the carbohydrates as much as people are telling me. It's just that carbohydrates are a lot easier because they're more affordable for people, and it's an easier way of living rather than having to go get more of the fat protein products, which might be a little bit more money, and it might be a little bit more of a challenge to live a lifestyle higher in that than with the carbohydrates, and not even just carbs. You got to talk about the processed foods and the fast foods and the sodas and all the sugars that everybody gets from that source. So, I mean, it just makes sense when you hear it from this point of view, but there's not a lot of people that are sharing this.
Right. Well, let me just have you answer sort of the two most common questions I hear in terms of the high fat, low carb eating. So one, people have the concern if they're not going to eat a bunch of grains, where they're going to get their fiber from. And then the other, in particular with diabetes, is a lot of people are afraid of the word ketones because they've heard of, ketoacidosis and so forth. So can you talk about those two things real quick? Yeah.
It's funny that you said that. I literally just talked about this the other day in my talk. Yeah. So it's a perfect question.
Yeah.
So I'll take the first one about the fiber. Believe it or not, you get a lot of fiber from your green leafy vegetables. And when I say to have low carb, it's not no carbs. It's just low carb. And most of your carbs should be coming from mostly vegetables and then your low glycemic fruits. So if you have a diet that's high in green leafy vegetables, which is your spinaches, your kales, your Brussels sprouts, broccoli, I mean, those type of vegetables are very important for the body, and that's where you're going to get a lot more fiber than from the carbohydrates that they think they're getting it from. So believe it or not, the good carbohydrates you're allowed to have give you the fiber that your body's looking for. So that's the question number one. And number two is this ketones versus ketoacidosis, which is exactly what I just said in the talk the other day. So when you look at ketoacidosis, it's usually done with people that have diabetes, so it's called DKA, and the people with diabetes have high blood sugar. So in order to get to ketoacidosis, number one, you have to have high blood sugar. Number two, your ketone level in your blood has to be between, I think the number's like 12 and 15 millimoles or something along those lines. I don't know the exact numbers off the top of my head, but let's just say more than 12 millimoles. And then obviously there also is a event that has some type of bacteria or virus also involved. So when you look at those three things your body needs in order to get into ketoacidosis, now you look at what ketosis is. Two different words. The only thing that's the same is the word keto. But ketosis, which is from nutritional ketosis, number one, if you're in ketosis, you're having a low carbohydrate diet, meaning your blood sugar is going to be balanced. You're not going to have blood sugar issues. So that takes out the high blood sugar problem. So that already takes that away. So now you're already one step less than getting to ketoacidosis. Then if you take the blood of somebody that's on ketones, or not on ketones, but in ketosis, if you look at the amount of ketones they have in their blood, they're nowhere near 12 to 15 millimoles. It might be between, say, 1 to 3 millimoles. So it's like 10 times less the amount of ketones in the blood than you would have to do to get to ketoacidosis. But they just hear the word keto and they think automatically it's bad. So when you're in ketosis, your blood ketone level is lower. It's in about the, say just 1 to 3 level, and your blood sugar is under control, and the insulin that you have in your body doesn't have to work as hard. So because you don't have so much glucose, that's not even a problem. For ketoacidosis, usually people have high blood sugar and not enough insulin to lower that blood sugar. So when you take out those problems, it's almost physically impossible to go from ketosis, nutritional ketosis, to ketoacidosis if you're doing the correct diet. Gotcha. So that's the big difference between ketosis and ketoacidosis. But they just hear that word and they just automatically think that's what's happening.
Right. Right. Yeah. I mean, I've even heard of people having doctors that say, "Oh, no, don't do a ketogenic diet because that's dangerous." Because they have still that gap in the understanding for sure.
Yeah. And you also want to clear up the difference between a ketogenic diet and an Atkins diet. Mm-hmm. A lot of people think they're one and the same, and even doctors hear that the ketogenic diet and they think high protein. Because if you look at Atkins is a high protein diet, and there has been a lot of doctors that do say, having too much protein could be taxing to the body, and you could get ketoacidosis, which could potentially be true because if you're on a high protein diet and you're not controlling the amount your body needs, the excess protein at high amounts can turn into blood sugar and cause spikes in the blood sugar, which could get you towards that direction. The big difference, though, is a ketogenic diet is high fat, moderate protein, and then low carb. So the amount of protein you're supposed to have a day on a ketogenic diet is only between 20 to 30% of your diet. On a Atkins diet or a high protein diet, they're going a lot higher than that. So it's really important to know that on a ketogenic diet or a high fat diet, your diet should be mostly fat, moderate protein, very low carb. So that's a big distinction that needs to be heard, because if the doctor thinks they're associating ketogenic with high protein, they're not understanding it correctly. Ketogenic is high fat, high protein is more of an Atkins type diet, and that could potentially be dangerous on the body.
And so then let me ask you this, because we're obviously covering both types of diabetes. You yourself have the type 1, which, like we've said, is much more common among young kids and so forth. So is this type of ketogenic diet safe, and does it work for kids, or do kids need more carbohydrates in their diet because they're growing?
Yeah, so no, it's not an age dependent thing. I mean, like we said, we've been tricked. I don't want to use the word trick, but we've been told. Sorry, I just got this thing. There we go. We've been told all our life that our main nutrient that we need is carbs, or bad carbs. I should clear myself. It's not all carbs. It's the bad carbs. It's the white breads. It's the pastas. It's the bagels and the Eggos, and all of those things are horrible for our body. So don't get me wrong. Like, carbohydrates are important, and there are good carbohydrates you can have. But if you look at the majority of diets that people live, especially kids, just look at the day of a life of a kid. I would probably be confident to say more than half of their diet is the bad carbs. I mean, they wake up in the morning, they might have a waffle or bagel, pancakes. It's rare that you're going to see them get bacon and eggs. They might see it, if you have a more health conscious family, that they might say, let's have bacon and eggs this morning. But it's more likely to get the quick, let me just toast up a bagel, put some butter on it, and give it to you. Where then all of a sudden, that's like, let's just say 50 grams of carbs right at that meal. And then you wonder why your kid's wired all day because they have all this sugar. And then it's what are they having for lunch? They might have a pizza, they might have a sandwich, they might have, God knows what else they're having. They might have cereal, macaroni and cheese. All these things that are still, again, loaded with carbohydrates, the bad carbohydrates. So it would be very beneficial for a child, to adopt this diet. Even just to maybe not be 100% strict to the keto diet, but at least adopt a low-carb diet. And that might be the first step forward, is just adopting a low-carb diet and maybe not going 100% keto. But obviously the keto diet is going to be great. And, fat and protein is even great for neurological development. So when you're developing as a child, you want as little stress on the neurological system as you can. So if they could burn their body's fat and protein and use ketones as their main fuel, that fuel, the brain loves that type of fuel. The brain doesn't actually love glucose. It'll take it because it needs it when it's there, but it would rather have a better source of energy. So, yeah, I mean, it's totally healthy for a child to adopt this lifestyle in addition to an adult. Whether they're on type 1 or type 2 diabetes, the only thing they have to be careful with is if they are type 1 diabetic at a young age, they're relying on the insulin. Now, if they get on a diet that's low carb, they have to make sure they're adjusting the amount of insulin that they're taking. You wouldn't want to have to take the same amount of insulin you're taking on a low carb diet as you would on a high carb diet, because that would significantly change, and that could put them in a risk of lowering their blood sugar too much because they took too much insulin. Mm-hmm. So that's a very important point to make, is if they do adopt this type of style diet, they definitely have to monitor their blood sugar more, and they have to monitor their insulin intake more. And then for type 2 diabetics who are on the medicine, they need to make sure that the doses of how much medicine they're taking to counteract their high blood sugar is changing as well, because you don't want to get too low. There's obviously dangers of being too high with blood sugar, but then there's also dangers of being too low on blood sugar, and that's where it could get in a dangerous state. So monitoring blood sugar, insulin, and medicine intake during the ketogenic diet is more important than just adopting it. It's adopting it and then making the lifestyle changes that you need to make in order to allow your body to still have a good balanced blood sugar.
Gotcha. So let me ask you this then, right? So I'm a parent, say, and I have a kid who's type 1 diabetic, and they love their cereal and pizza and macaroni and cheese. And so now you're saying, wait a minute, I got to take all that stuff away. And I can't eat any of that good stuff, that good stuff. So what's good on the ketogenic diet? Like what am I going to give my kid that they'll like to eat?
Yeah. That's a touchy question, because You're right. That's the hardest thing to do on anybody, is to change their diet, let alone a young child who it looks forward to that food, because believe it or not, they're actually addicted to it. Uh-huh. There's an addictive component to carbohydrates and gluten and stuff that actually goes to the same brain centers as drugs that people take recreationally. So there actually is an addictive component. So it is a very hard thing to do. And, I personally don't have a child, so I haven't had this issue come on, but I could say I treated myself as a child, like a child. And you just have to somehow get them to realize that it's not going to happen because it's not good for their health. Like, as a mom and dad, your sole purpose is to protect your children. So if your children said, I want to run across the street when this car is coming, you as a child is going to say, I don't care if you want to do it, I'm going to stop you because it's a danger to you. So you have to take that type of mentality when it comes to what they're eating. Like, I know you want to have the cereal, I know you want to have the pancakes, but under my roof or under my watch, you can't have that. It's not good for your body. It's going to raise your blood sugar too much. It's not going to be healthy. And yeah, obviously they're going to fight it, but you as the parent have to know that that's the most important thing, is keeping them safe and healthy. So then what do you have for breakfast? So I could give an example for breakfast. Bacon and eggs is a great one, and you can make it fun. You could put different fruits and vegetables in it. You can put different, seasonings and stuff to make it tastier, because that's all good stuff. So like in the morning you could do bacon and eggs. You can do like sausage or some other type of meat in the morning. You could even make, like, they have nutritional supplements that are like multi-nutritional shakes. You can make a shake in the morning for the kid. There's ketogenic shakes that are made out there. There's vegetarian. Like, I personally like to take Vega 1. Vega 1 is a vegetarian version of protein that is in a multi-nutritional shake. So they can make a nutritional shake, and inside that nutritional shake, you can make it fun for them. You can put peanut butter or almond butter in it, because that's a good source of nutrition. So they can feel like they're having something good, but it's a better source of nutrition for them. So that could be in the morning. You could put, you could blend up the shake with green leafy vegetables and peanut butter and almond milk or coconut milk and make it look like it's good. They don't have to know what's in it, but when you know when you drink it, you're not drinking it knowing, oh, this has coconut milk in it and this has peanut butter in it. Like, they're just going to like the way it tastes. It's just that it's a lot easier to have the children not whine in the morning and complain and just say, I'm just going to give them what they want, because I'd rather do that than not hear their complaining. But if you really have control of the situation and you're not doing it to harm them, you're not doing them to restrict what they want, you're actually doing it for the betterment of their body, because that's the most important thing. You would not want them to run across the street while that car is coming to get hit. You should not want them to have all these carbohydrates that are ruining their lifestyle for the rest of their life. Right. So that's a breakfast. And then for lunch, instead of getting pizza or getting a sandwich or something like that, choose something that doesn't have the bread source. So instead of getting a chicken parmesan sandwich, we'll get a chicken parmesan entree dish. They still get the same thing, but they don't have to have the high bread. So that's a way to do it. You can alter it by just taking out the bread source. But yeah, I mean, it's definitely the hardest thing that I've noticed for myself and for people in my life that I try to help is changing a dietary lifestyle that they're used to. But it's just breaking habits. It's not that they actually really want that. It's just as a habit that, okay, I'm getting up in the morning, I'm having my cereal. If you taught them in the beginning of their life, I'm getting up in the morning, I'm having bacon and eggs, like, that's going to be their new excitement. But it's in their habit, and the people are creatures of habit. They don't want to change things that they're used to. But, you got to think of what's more important, their habit or their health.
Sure. Well, I mean, in some of those things you mentioned, I mean, I know my kids love them, and I don't find too many kids that aren't big fans of things like bacon and breakfast sausage and stuff like that too, So it's not like all just a bunch of really boring stuff. And, they talk about in the culinary world that fat is where the flavor is. So it seems like if you're not worried about the fat anymore, butter and all that kind of stuff, that you're going to, be able to still have a lot of flavor.
Exactly. But that's what we're taught: the butter and the fat is bad for us,
right.
which is where this mindset came. It's not that carbohydrates are so tasty and fat and protein are not so tasty. It's that we've literally been taught that high fat causes clogged arteries, which causes heart disease, which is not true. Mm-hmm. But that's what's been taught, and people have, and a lot of people have monopolized on that. There's certain industries that have monopolized on that, and they can make a lot of money off of high carbohydrate processed foods and not as much of the healthier foods.
Right.
So it's a sad part of our world, but once you realize that the high fat is not causing heart disease and the high fat is not causing obesity, you realize, wait, well, if it's not the high fat that's causing that, maybe it's actually the high carbohydrates that most people are on. Because if high fat and protein, you can even just think of it logically, if high fat and protein are causing the heart disease, yet most people are saying don't have a high fat and protein diet, well, that means most people are not on that type of diet, then why is diabetes and heart disease rising at epidemic ratios? If most people are eating more carbohydrates, it doesn't make sense. Maybe the reason why it's rising so much is because the carbohydrates are what's drawing the body to be inflamed and what's drawing the blood sugar to rise. And then maybe you look back and say, holy crap, that makes more sense than, well, I was told by my doctor, don't have high fat and protein, so I'm not going to have that. But then they're going to have the carbs, and then it's going to compound the problem.
Right. Well, and I mean, I think it was about a year or two ago that the story was finally released, how the sugar industry paid off the researchers back in the 70s and 80s to leave out the data that showed sugar was a big cause of heart disease and point the finger only at fat, Mm-hmm. And so it's only now that that's being revealed, sort of in the general mainstream public, and people are starting to get wise to it, hopefully, Yeah.
So it's the research is starting to finally catch up to the natural, holistic mindset. Allopathic medicine, it's a great industry. It helps and saves a lot of lives. We don't want to put that, away. But, when it comes to nutrition and when it comes to the natural abilities for the body to heal, they're not as versed on that. Not saying they don't care about it. They're just not as versed on it. They're not taught that. So they're going to be teaching their patients what they were taught. But when you're not taught that nutrition can help heal and that the body has an amazing ability from the nervous system to heal itself, and treating the thing that affects the nervous system the most, which is the spine, they're not taught that. So they're going to go with what their background was. But now the eventually research is going to finally catch up and say, well, wait, no, there is this research showing that the body does have this ability to heal, and your posture does matter, and what you put in your body and sugar levels affects. So it is starting to come more common now to see these type of things come out. Plus, people are getting sick. They're getting sick and tired of being sick and tired. Yeah. So, it's only a matter of time where people start to wake up and hear this information. And I hope this gets shared, 5,000, 10,000 times. And this is really something that really gets out there.
Me too, because I think it's so vital. It's such valuable information to be able to put in place to really make a difference in a situation where most people are told there's really nothing you can do, and you just got to take the medication for the rest of your life, and hopefully, it goes okay for you. So let me ask you then, and this is just sort of out of the blue, so I have no idea what your answer is going to be. But in terms of your vision looking forward for you and your health and your body and these changes you're doing with the ketogenic diet and the different stuff, do you see it as a situation where you'll be able to heal completely from this?
That's the question that ponders in my mind every single day. Mm-hmm. In the very, very beginning of the disorder, I was 100% sure that was going to happen. I said to myself, if I clean up my gut and I remove all this food, I'm definitely going to heal myself 100%. But after a year and a half of doing this, I was testing the waters in different ways. And I even tried to get to the point of, let's get my insulin level as low as I can, at nighttime. So I started as high as, taking, I think I was at 14 units of Lantus, which is the long-acting insulin that I was taking. So I was up to 15 when I was at my highest. But I got that down to being as low as where I got my lowest, I was taking 5. But when I saw myself taking 5, I noticed that when I woke up in the morning, my blood sugar was always higher than I wanted to be. Then over the past couple months, I said, well, let me see if I just take a little bit more of the Lantus at night, still live my lifestyle, and see what happens. So when I brought that level of Lantus up to between 8 and 10, I woke up with my blood sugar lower to where I want it to be. So I think I just need a baseline insulin that maybe my body lost, and the rest is all lifestyle. So there's a certain baseline that I need, but I'm still not 100% convinced that I'm going to have to do that the rest of my life. But as far as I thought in a year I'd be healed, and I'll be the first person in the world to say, I reversed diabetes in 1 year. That was my mindset. But after living it for a year now, I could say there's an aspect of, if your body can't make insulin, you do have to get an external source. But that's a small percentage of the people with diabetes. There's a much smaller percentage of people with diabetes with type 1 than with the other ones that are more preventable. So I don't want to focus my energy on the 1 or 2% chance that, I might be on insulin the rest of my life. I'm going to focus on, if I live a lifestyle that is not driving my blood sugar high, well, at least I could have that on my side. And I could teach that to people, especially type 2 diabetics, that if you're on that style diet, you can go live a life that you don't need medication at all. At least that a type 2 diabetic has that option, is they're not reliant on the insulin, they're reliant on the lower glucose level. Whereas a type 1 diabetic has a different situation. They might have to have some source of insulin coming into their body, but they don't have to use it at every meal and consume their life with, how much carbs did I have at that meal? How much do I have to counter that with the short-acting insulin? How much do I have to make sure that my pump, if they're on a pump, that it's working? What if the battery gets low? I mean, there's so many different things that could occur that you never know what could happen. What if I forget to, take the insulin when I eat my meals? Is it going to spike up? So, I mean, at least in the diabetic world that's type 2, it's more lifestyle driven. So you can live a lifestyle where you can reverse it if you take out those things. Type 1, I don't know. I'm still using myself as a test dummy. Right. And if I do get to the point where I did totally reverse it, hell, it's a hell of a story, and I hope it gets to the world.
Absolutely, absolutely. Well, so why don't you tell us, one, how people can get a hold of or in touch with you, after this, if somebody's like, hey, I want to learn more from this guy and do that type of thing. And then in addition, like, what are some other great resources for parents or for people with diabetes to look online and that kind of thing?
Sure. So for me personally, I mean, the best way to reach me, if they're big on social media, I mean, I'm on Facebook. If you just search Dr. Marco Ferrucci on Facebook, I'm on there. On Instagram, I'm Dr. Marco _Cairo. I'm on that. My email is very easy. It's just dr like in doctor, my full name, Marco Ferrucci @gmail. Those are great ways of getting in touch with me. On the business page that I have, the Chiropractic Source, that's our business page if you want to go that route. But I do a lot more of the individual coaching and education on my Dr. Marco Ferrucci page. And then as far as different resources, I mean, if they're interested in the ketogenic diet, the best resource I found, if you just search the ketogenic diet, there's one website and one book that was made. It's I think it's called, let me think about what it's called. It's called The Ketogenic Diet for Type 1 Diabetes. There's also one called The Ketogenic Diet for Type 2 Diabetes. There's also one called The Ketogenic Diet for Cancer patients, or something along those lines. So there's a resource, I think it's the Ketogenic Resource website or something along those lines. I'll find it and we'll share it, in the message. But that resource is great because not only does it give you the book that I read that started teaching me this, but it also gives you a website that shows like what are high fat foods, what are the different food charts they can use that allows you to see how much carbohydrates, fat, and protein are in your foods. So it's a great resource. So that's another one. I'll share all those links. So that's for the ketogenic diet. But as far as that, I mean, it really just comes down to knowing that in the world of diabetes, bad carbohydrates are a fuel to the fire. So when you have that understanding, reversing your diet to remove more of the fuel to the fire and put more of the stuff that are going to calm down the fire. That's the biggest way of closing up is there is a way to live that doesn't drive blood sugar crazy. So that's the best way to probably start the process. I mean, it's going to take years sometimes for people to really get it under control. I luckily only took 6 months, but it's because I caught it early. There might be people that have had high blood sugar for 10 years, and it might take them 2-3 years to really get it under control.
Yeah, well, and that's the thing with any nutrition, lifestyle, dietary changes, depending on where you're starting and where you want to go, it can be a long journey, but it's, doing it in a stepwise manner is what I found working with families and parents. And knowing that the goal is out there, and it might take you 3 years to get there, but that's no reason to not do it. That's all the more reason to stick with it. Yeah. So I appreciate that message. Well, thanks so much for joining us again, and really sharing your own personal story. I think that's going to really help a lot of people understand and empathize with us, or relate to the story and the changes you've had to go through. And hopefully give them some information and some motivation to be able to, institute those changes with themselves or their family and their kids and that kind of stuff. So I really appreciate it. It should help some people make some really significant changes to the potential, long-term potential in terms of kids, of their health and their life. So thanks so much.
I appreciate you having me on. I mean, I'm so happy that we're able to share this information because, I mean, at this point, it's very rare that you hear this information shared.
Yeah. For sure. And like Dr. Marco mentioned, we'll get those links in the show notes if you're listening on the podcast. And if you're watching the broadcast on Facebook, you'll see them there above the video. So thanks again, and you take care. And we'll see you guys next time on the Kids Eating Broccoli podcast. If you enjoyed this episode of Kids Eating Broccoli podcast, connect with us online. You can find us on Facebook at Kids Eating Broccoli Podcast, or at Dr. Brad Ellisor DC. You can also go to our website, drellisor.com. That's DOCTORELLISOR.com. Go to iTunes and leave us a review and a rating, or on Stitcher. And be sure to keep in touch with us so you can hear the next episode. Sign up for our mailing list or like us on Facebook. You guys take care now. And let's make the next generation the best generation.